One silver lining of the pandemic has been an unprecedented focus and attention on diagnostics. However, focus on COVID resulted in other diseases being overlooked and the progress being lost. For example, tuberculosis, where there has been a massive decrease in notifications, with India alone accounting for 40% of this decrease. Another challenge has been a sort of a lack of balance between supply and demand, resulting in a vicious cycle. Countries unable to advocate for things that don't exist, and companies not wanting to invest in developing new tools without visibility on a potential market and the return on their investments. Hence, the need for clarity on the country priorities and a greater transparency in the market. As a global alliance for diagnostics, FIND connects countries and communities, funders, decision makers, healthcare providers, and developers to spur diagnostic innovation and making testing an integral part of sustainable, resilient healthcare systems. According to the recent Lancet Commission on Diagnostics, 50% of the world's population does not have access to diagnostics. Our priority is therefore to ensure that everyone who needs a test gets one. Our current strategy is focused on addressing diagnostic needs to protect against pandemic threats, including but not limited to COVID, and achieve universal health coverage, essentially two sides of the same coin. Going forward, making high-quality tests accessible to those who need them should be the guiding principle behind advancing access to testing. It will be critical to build on COVID to accelerate innovations for other diseases, including tuberculosis, investing in true point-of-care molecular tests, innovations in sample types, for example, urine and aerosol-based sampling, among others, and tools such as digital X-ray and computer-aided diagnosis are going to be key. Strengthening health systems by investing in training and capacity building, leveraging community-based models to advance access to the last mile, investing in surveillance as a part of pandemic preparedness, and more efficient use of existing diagnostic tools through mechanisms like diagnostic network optimization will also be critical. In terms of emerging trends, tools that put the patient first, for example, point-of-care multiplex tests, so that presence of multiple diseases or pathogens can be checked with a single test, making it easy for the patient, and in places that are convenient to access, including at home. Greater understanding of the barriers to access, such as challenges unique to women and children or vulnerable populations such as prisoners, and accelerating innovations designed to overcome these challenges are on top of the priority list. I'll end by saying, don't overlook diagnostics. The pandemic has shown how key diagnosis is to managing health at an individual and at a population level. There is a strong momentum now on account of pandemic, and we must continue to build on that through continued investments in local innovation and improving access to testing. Thank you.